Good morning, all. Am I audible? Okay, great. Good morning. Starting with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master Samuel Hahnemann for this wonderful divine science and who taught us dare to be wise. We are seeking blessings from our Guru, Dr. Prafull Vijayakar sirs, who made this divine science and connecting this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijay Karayaman. So, friends, we are in the journey of reading Organon and the source book, The End of My Assumptions of Miasm. So, up till now in Organon, we have read about a certain aphorism. So, today the aphorism number 61 had been physician been capable of reflecting on the sad result of the antagonistic employment of the medicines, they had long since discovered the grand truth that the true radical healing art must be found in the exact opposite of such antipathic treatment of the symptoms of the disease. Even allopaths know that this antipathic treatment is not of value. They would have become convinced that as a medicinal antagonistic to the symptoms of the disease is followed by only a transient relief, and after that is passed by invariable aggravation. The converse to that procedure, it is exactly opposite to this antipathic mode of treatment. The homeopathic employment of the medicine according to the similarity of the symptoms must effect a permanent and perfect cure. So this is what Master Hanuman is telling about the superiority of homeopathy over the heteropathic treatment. If at the same time the opposite of their large doses, the most minute doses are exhibited in the homeopathy. So aphorism number 62. Again, what 61 says that, but neither the obvious aggravations that ensued from their antibiotic treatment, nor the fact that no physician ever effected a permanent cure of the disease of a considerable or of a long standing, unless some homeopathic medicinal agent was accidentally a chief ingredient in this prescription. So sometimes they found the result, but that is because of some accidental homeopathic medicine is used. Nor yet the circumstances that all the rapid and perfect cure that nature ever performed were always effected by the superventions upon the old disease of one of the similar character. Ever taught them during such a long series of centuries this truth, the knowledge of which can alone conduce to the benefit of the sick. What 62 aphorism number says that, but on what this pernicious result of palliative antibiotic treatment and efficacy of reverse means efficacy of the homeopathic treatment depend is explained by the following fact deduced from the manifold observations which no one before me perceived. This is what Master is telling us. Though they are so very palpable and so very evident and are of a such infinite importance to the healing art. So this is what Master is telling about that antibiotic mode of treatment का रिजल्ट नहीं आ रहा है पैलिएशन हो रहा है और इन रिवर्स होम्योपैथी क्यों रिजल्ट दे रहा है it is found by the manifold observations which is perceived by master animal. So how they perceive? So master perceive that every agent that act upon the vitality, every medicine deranges more or less the vital force and causes a certain alterations in the health of an individual for a longer or a shorter period. This is called as the primary actions of that particular agent or a medicine. Although a product of the medicinal and the vital power conjointly, when it is combined, is principally due to the former power. To its actions, our vital force endeavor to oppose its own energy, that is a resistance. This resistance action is the property, is indeed an automatic actions of our life preserving power, which we call as the immune system or immunity, which goes by the name of secondary actions or the counter actions. So what Kant has write to this also that our medicine do not cure the patient. Our medicine just stimulate the vital principles or the vital energy which is residing in our body, and the resistance of that vital energy will react in a different way, and that is curing ourselves. So this is what Kant has write in the preface of a repertory, last few lines of that preface. It is like that. So this is what you have to keep in mind. So, aphorism number 64 says that during the primary actions of the artificial morphic agent, which we call as medicines, on our healthy body, as seen in the following examples, our vital force seems to conduct itself merely in a passive or a receptive manner and appear, so to say, compelled to permit the impressions of the artificial power acting from without to take place in it and thereby alter its state of health. It then, however, appeared to rouse itself again, as it were, and to develop two possibility. There is a two possibility, one and two, the A and B. The exact opposite conditions of the health, that is called as the secondary counter actions. This effect to the primary actions produce upon it, if there be such an opposite, and that is as great a degree as was the effect of primary actions of the artificial morphic or medicinal agent on it, and proportion to it its over energy. So this is what the antibiotic mode of treatment. Whenever you apply certain things, it produces a primary action to relieve it, and the exactly opposite action, that is counter action, which aggravate again and again. So, for example, opium is given for the diarrhea. In a primary actions, it stop the diarrhea, but in secondary counteraction, it produces more positive or more constipation. So that is what the exact opposite of. And the second possibility of, if there be not in a nature a state exactly opposite of that primary action, it appear to endeavor to indifferentiate itself, that is to make its superior power available in the extinctions of the change brought in it from without by our medicine, in a place of which it is substituted its normal state, and that is called a secondary curative action. So that is what our homeopathic medicine is based on the symptom similarity, which is not exactly based on the law of contraria contraries. So this is what it is not the exact, but it is a similar or a simillimum to that, not the same things, exactness. So that is what indifferentiate, and the superior power of medicines help to stimulate the vital force, and in return the vital force produce a secondary curative actions. So this is what the some of the example was given in aphorism number 65. So we will read it tomorrow. Again, we are reading the book The End of My Assumptions of the Miasm by Dr. Prafull Vijayakar, sir. So up till now, we have read many chapters from this book, and you all are well versed of understanding these books in such a way that you get idea of how our medicine or how our system is defending in such a way. So as that we have understood up till now that the miasm is the process in which uh, our body is defended or governed by the genetic code, and that genetic code has some cellular functions, and that cellular functions represent in the form of the physiological functions and represent in the form of the morphological functions. So these physiological functions represent as the balance of the harmonious represent a sora, whereas the morphological constructive changes represent the psychosis, and the morphological destructive changes represent a syphilis. Again, we have read that the disease produced by the sora in form of the inflammatory changes at the level of the cellule. So all itis are there in the sora. And then we found that the constructive mode of defense mechanism, when the cell's functions of the reproduction is compromised to one is to more than two or one is to less than two, and that is represented in the form of psychosis excess and psychosis less, in the form of accumulations, depositions, synthesizing of the proteins, and proliferations. And then we read about the destructive, morphological destructive process in the form of either a necrosis or a apolysis or apoptosis. So in that also there is a degenerative changes happening at the level, and it is represented as a distortion, degeneration, destruction, and out of control condition. So this is what we have understood in the physical plane. Same way we have understood in the mental plane also. The sora is represented as the consciousness, represented as the sensitivity, represented as the inhibitions, and that inhibition lead to the anxiety and many things. Then in a psychosis, we have a cover due to the base behind that is a facade. So that is what covering. So projection is there, and the projection in the forms of everything in the form of will, intellect, moral, attachment, sensitivity, and everything. So this is what we have read up till now. Then in syphilis also, anything which is a distorted, anything which is out of control, anything which is destructive in nature, in the form of either a behavior, in the form of either an attitude, and that is what we have read up till now. So this is what the summary of the learning. Now today we are going to read about same things, the miasm in the dreams also. So dream is a part of our subconscious pattern, and some of the subconscious things which is reflected in the sleep in the form of dream. So this is what the dream also. If the person is having a defending in the soric manner, so there must be a dream also of a soric manner. If the person is defending in a psychotic manner, so there must be a dreams of also psychotic manner. And if the person is defending in the syphilitic manner, there must be a dreams of syphilitic manner, because our conscious and subconscious mind is defending in the same manner. That is what Sir has said, that the mind and body tells the same language. Sorry. So today we are reading the chapter 25, the miasm in dreams. The significance of miasm in a dreams. As mentioned earlier, the miasm, which is the defensive trait of the body, has to reflect on the mind, body, and the disease tendency, likes and dislikes. All these are the conscious aspect of the human being. If it goes through and through the same defense tendency or the miasm, it is also reflected in the dream, which is the part of our subconscious self. More often than not, the dream or the subconscious mind is the forerunner of things to come. On the other hand, the dream can be the result of the state of the mind too. So that is why all repertory, the dream chapter is reflected in the chapter of mind. An individual dreaming of the snake biting him or terrorizing him is a bad sign. This invariably indicates that the individual is going to develop or has already developed some autoimmune or an incurable disease. So this is what very important aspect of understanding. So whenever you find, don't take directly the rubrics that dreams of the snake or dreams of biting snake. It is not the entry point, but you can understand that this is something that is leading to the autoimmune process or some incurable disease in the process. So this is something that is a syphilitic dreams. So whenever the person telling you that I might have a dreams of the snake, so you beware that the person in a very soon era, the subconscious pattern is thinking in the syphilitic manner. So soon the patient may go into this syphilitic disorders at the physical level. So this is very important to understand that this dream. So whenever you prescribe a remedy and after that the patient says that previously I used to have dreams of the snake and now I don't have any dreams after your medicine has been started, that means that is what the change of the shifting of the miasm from syphilis to the psychosis. So this is what very important understanding that you have to keep in mind, that something which is there. So the individual dreaming of the snake is a bad sign and develop already the autoimmune or some incurable disease. So there are the dreams such as the dangerous dreams of the fire, accidents and mutilations can indicate the syphilitic tendency. So this is what the fire, accident and mutilations gives rise to destructions. Okay, syphilitic disease existing in the body or else about to invade the body. So this is what a dream is, a subconscious pattern. So sometimes the subconscious pattern followed by the conscious process and the physical representation. The same way if the patient is developing this type of dreams, so he may be having some syphilitic disorders or he may develop a syphilitic disorders soon in this process. Dreams of accumulations or the constructions can indicate some psychotic disease in its as a offering. The soaring dreams are the dreams of the daily works, the anxiety or the irritation. So this is what you have to keep in mind, that the dreams of accumulations and constructions are the psychotic dreams. Dreams of the dangerous dreams of the fire, accidents and mutilation can indicate the syphilitic disease. This often helps us in assessment of the follow-up of the case and which tells us whether it is following the Herring's law or not. So this is what very important aspect of understanding. That if the patient is telling you that previously I used to have a dreams of the bloodshed, I used to have a dreams of the battle, I used to have a dreams of the blood, I used to have a dreams of fire, I used to have dreams of mutilations of the body. And when the patients come in the follow-up and patient is telling that now no that much of dream, but I used to have a dreams of I am going somewhere else, I am going in a leisure, I am having some bungalows and I am residing in some resorts and I am enjoying my life. So that is what the subconscious pattern shifting from the syphilitic to the psychotic disease. So this is what very important to understand, help us in the assessment of the follow-up. So here the case was given, the illustrative case, sorry. In case of the homeopathic doctor who had a 99% block of the left carotid and 80% blockage in the cardiac blood supply in the left LAD. This type of evaluation through the dream proved very useful. This person had right hand paralysis due to the left carotid block. He was depressed and we'll have a question answer at the end, so we'll answer that your questions, doctor. Don't worry. This person had right hand paralysis due to the left carotid block. He was depressed and in a total distress. A very strong and dictatorial man was weeping continuously and hugging everyone as if this was beginning of his end. He had had an attack of ischemia 1 year prior to this. The doctor had given him very less chance of survival, and even operations to remove two blocks at the time was a great risk. To assess the block in a few days was very difficult. How does one realize that the remedy is right and we are on the right track? So this is what very important understanding that internal block. How can we understand this block has been removed or not? So this is what our understanding to understand that the reversal of miasm is happening or not. The block is completely psychotic and hidden. In this case, the patient has a dreams of jugglery. On the first day of starting the treatment, he was perhaps his biochemistry, which was disturbed due to the excess allopathic drug, was trying to return back to the equilibrium. He was quite depressed and confused as to whether he had taken a right decision or not. He wanted to be assured that the medicine was working inside him and that he was not wasting a time. On the third day, he became mentally relaxed. He started smiling and taking interest in watching television. On the fourth day, he started moving his right hand that was paralyzed, and the first thing he did was to sign on his checkbook to withdraw all his money from the account which had become frozen without his signature. On the fifth day, he reported of having a dream in which he saw that he was visiting a site where a house was being constructed, and this house belonged to a prominent mafia boss who was accompanying him there. He was surprised because he was never ever associated with this man, and why should he came in his dream? Above all, he had nothing to do with any constructions or the designing. For me, this dream had some different meaning. He was in a total despair because of his conditions of the paralysis of the right hand when the single dose of similimum was given. This was the syphilitic stage of the disease, which was characterized by the paralysis and the despair and overwhelmed with the emotion. Now he was seeing a dream which shows the constructions, a mafia boss, and designing and the creativity, all of which is characterized the psychotic miasm. This indicates the disease of arteriosclerosis comprising of accumulations of the construction which had earlier progressed to the syphilitic stage of destruction was now on the point of returning back to the psychotic state. For me, this was an indication sufficient enough to assure him that the disease was under control and that my simulation had started working. This indicates me the sixth corollary of the return of the disease from the more destructive miasm to the less destructive miasm was being seen and the cure was in a progress. On these very indications, I could distribute. him from going in for any operations. After the eighth day, he got a dream in which he saw himself and his sons driving a huge truck through a very narrow lane. He got down from the truck and the son went to park the truck in the parking area and did not return. This gave him a lot of anxiety in the dream. Here the huge truck was like a psychotic block in the narrow artery, indicating the psychosis predominance. The later part of the dream shows the anxiety which was soric. This means that he was now returning to the psychosoric sphere. A few weeks later, he got a dream where he saw his clinic bugle. He saw the lock in the broken state on outside of the closed door, and there was a tremendous apprehension and anxiety about what he must have lost. This was a clear dream of the soric anxiety. After this, his hypertension, blood sugar, lipid level, and serum uric acid level of all of which were never normal before, even with the help of allopathic medicines, become normal without any maintaining drugs and still remain normal today after 5 years. So this is what the reversal of the miasm in terms of dreams, a psychotic, soric, or a syphilitic dreams comes into psychosis, psychotic dreams comes into sora. So you have to intervene in the forms of miasm, not just as take as the dreams of this or only this. The remedy that saved him and the basis of prescriptions, he was a man of principle and discipline and consistency, a friend of mine for 35 years. This man had never forgotten to post any greeting card to any of our friends in 30 years, though nobody sent him in return. He was very strict for the time. He would get up in the middle of any party to maintain the time. His typing of his clinic, in spite of having a huge practice, was very fixed. He was neither one minute early nor late. Everybody in the family had to listen to him and obey his rule. Because of his disciplinary tendency, he was the first choice of any organization to become a secretary or president. It was more of a perfection in time and activity concern rather than the activity of keeping things in the place. He was not fond of wearing aristocratic dresses at all. He could not bear any contradictions of his orders which would send him into anger. Nowadays his anger and vexation has started causing him breathlessness. He was chilly and thirsty. So, on the basis of considering this rubric, ailment from emotions leading to the difficulty in breathing, mental makeup, discipline, behaving like a general's rubric taken as rigidity, the physical makeup was of a psychotic round face, stocky build, and the miasm is syphilis. The remedy was prescribed was the cuprum metallicum, which did the wonderful trick. In another case of the cancer of the bile duct, the dream initially seen were the hideous, horrible faces, and she would get up frightened. That was a syphilitic state. When she started improving, she started getting dreams of sadhus, which signifies the psychosis. Later, the dreams of small children, which indicate the soric dreams. She was given a period of 3 months of life expectancy by the oncologist, as against which she survived for 9 long years. So, this is what you have to understand the reversal of a miasm in terms of subconscious pattern as a dream. Along with the improvement in the dream, it is necessary that the patients improve mentally, physically, and generally according to the Haring's law of directions of the cure. Then and only then he is moving towards cure. So keep in mind that it also having, if it is subconsciously reversing, then the physical body and mentally the patient is reversing, and reversing. So this is what the Haring's law of cure. Now, what Sir has proposed that there are a few dreams and its example given by the Sir, which is helping us to understand that these are the soric dream, these are the psychotic dream, and these are the syphilitic dreams. So, Sir has given the soric dreams and the dreams of the daily activity. So, for example, the dreams of the cooking, dreams of the fishing, dreams of the flower, household affair, music, etc. These are the daily activity. These are for the enjoyments and daily course. So this is what the soric dreams is. Dreams of effort being done, whether or not success is achieved. It is also a dreams of the Sora. So sometimes you may find that I have started exam. So some have the dreams of examinations and share dreams of apprehension that how my paper is going on, what happened in exam, do I finish it? So these are the dreams of anxiety. So these dreams of either they have achieved success or not. These are the dreams of soaring. For example, the ascending a height, dreams of aspiring something, dreams of climbing a step, dreams of the failure, I might get success or not, dreams of looking for someone, and dreams failing to find him, or a train trying to catch. So this is what the dreams of effort, dreams of the struggle. These are dreams are the soaring dreams. Again, the dreams associated with the emotions, the certain emotions like the dreams associated with the emotions of the love, like affectionates, emotionals, grief, and vexation are more of a soaring dreams. Any dreams of anxiety or the pleasant dreams are also a soaring dream, like the dreams of seeing a beautiful country, driving a car, flying in a plane, a new scenes, a pleasant, a rainbow, or spanning the sky, or singing, and the wonderful dreams. All are the dreams of the soaring in nature. Psychotic dreams, the dreams of the psychosis means any of the collections, any of the gathering or the constructions. These are the terms. So you can think that any of the collections, so someone is collecting the money, dreams of the money, dreams of lying in the bed of the money, that also a psychosis. So this is what the dreams. For example, the dreams of assemblies or being a large or balls being at or buildings, dreams of the childbirth, that is the reproductions, dreams of the computer, dreams of the fruits gathering, dreams of the gardens, dreams of the body parts swollen. So these are there is a collections, gathering and constructions that gives a psychosis. If the person having a dreams of the business and money in the form of dreams of a good business, dreams of busy business, dreams of calculating, dreams of the company, dreams of the interview, or dreams of growing large, and dreams of the money. These are the psychotic in nature. Again, this is what the collection. Again, there is a frightful dreams. So, base of the psychosis is a fear. So, if there is a dreams of the frightful emotions, that also count into the psychosis. So dreams of danger, dreams of the death. So fear of death. This is very important. Fear of death. It is not exactly the death. Okay. Dreams of embarrassment, dreams of emotion suppressed, dreams of jealousy, some job related dreams, some deceitful dreams, or the political dreams. These are associated with the psychosis. Dreams related to concealing or something that is hiding. So this is what dreams of something hiding or dreams of the mask, etc., are the psychotic in nature. In this psychotic dreams of the fear of death, not the exactly the death. So this is keep in mind that the fear of death is the psychotic dream. But when there is a actual death or seeing a dead persons or seeing a death of someone, this is a syphilitic dreams. So syphilitic dreams are dreams of the accident, for example, plane crash, the exposal, the fire, the fatal things, etc. These are the dreams of syphilitic dreams, destructive dreams. There are the destruction dreams like the dreams of being beaten, dreams of bloodshed, body parts is burning, body parts is injuring or wishing himself, or cruelty, dreams of churchyard, dreams of funerals, dreams of offensive past, dreams of spitting, violence, ghosts, etc. are the syphilitic dreams. There are the perverted dreams that, for example, the dreams of woman married to the many. These are the perverted dreams. Dreams of the wild animal like the wild bird, large black wild animals, large bugs, the enormous or a dragon or the snake or a vampire or a wasp or a wild animal. These are the animals dreams are the syphilitic dreams. A clairvoyant dreams the dreams that happens to produce certain things, and that is what they found in the futuristic event. So someone having a preconceived things which is found in the idea in the subconscious pattern, and they said to someone else that I have that dreams and something will happen in the future. That is what dreams clairvoyant. Many a time dreams clairvoyant is very important rubric as a entry point, and sir took this rubric as a sorosyphilitic rubric. So in most of sorosyphilitic cases, a dream clairvoyant is very important, but not in a distorted or a psychosyphilitic case. Do not enter through the clairvoyant rubric. Okay, for that you need to attend the SCPH course so that you can understand the better way of how clairvoyant dream to be taken into consideration. So this is what the syphilitic dream. So we have a brief idea of how soric dream is presenting to us, how psychotic dream is presenting to us, and how syphilitic dream is presenting to us. Now we have another chapter, that is a chapter of aging. So the chapter 26, the aging. In the life of a man, encompassing his years beginning with his birth till his death, he runs through the spectrum of disease, which are essentially typed into three different phases. In short, a human life is divided into three major periods during the lifespan and move toward the death. So this is what, as we all have seen the first page of Myasum book, like this. You know, this is the clock of the age. So there is something which is up to this is a sora, from this to this is psychosis, and from this to this is syphilis. So this is what you have to keep in mind, the aging process. The first major phase is the birth to say the 20 years. The second phase is from the 20 years to the 50 years. And the third phase is from the 50 years onwards until death. The number of the years in which phase is strictly variable. So this is what not exactly to count that the first 20 years is a SORA. 20 to 50 is psychosis, and more than 50 is syphilis. It is not like that. But you have to keep in mind a brief idea of the age that the person is going toward a psychosis or person is going toward the syphilis. So this is what very understand. And the number is variable. These major phases are the period when there is a predominance of the certain disease. So this is what the sir's idea about the first phase. So the first phase from birth to the 20 years. It is known fact that the newborn or an infant or an even a teenager is brought to the physician not with the complaint of the rheumatoid arthritis or the hypertension or the diabetes, but for the different set of the complaints. The mother takes the child to the doctor for either a stubborn skin rash, recurrent boil, or an upper respiratory problem like the cold coryza cough, or at the most diarrhea, dysentery, or urinary tract infections. They are always or almost always inflammatory or infective in nature. This shows that in this first phase of life, when the child is in the learning stage, the disease encounter are due to the first defense, and that is the physiological defense, and this stage is predominated by the SORA. SORA stand for learning, growing, working to gain knowledge, and that will be essential for the person to make him and his family survive. So this is what for the survival and to satisfy the basic need of life. So this is what the SORA stand for. SORA stand for the learning, growing, working to gain knowledge that will be essential for the person to make him and his family survive and to satisfy the basic need. This line is very important whenever you are reading certain rubrics. So in the next chapter we have a rubrics. So to understand each and every rubric in terms of this process so that you can understand that why it is there given in the SORA. In this state, the defense that cells of the body uses is essentially and purely physiological in nature. In this state of man's career, the face and the feature shows the normal. So this is what how the face is look. So phase is shows the normal sensitive soric features. We observe that unless and until there is a strong inherited psychotic trait, the younger generation do not accumulate much fat. So this is what if it is psychotic soil is there, then it can grow the psychosis. But if it is not psychosis, then it remains a lean, thin, and everything. So this is what you have to understand. So they are a lean, thin, active, sensitive, all of which indicate the soric phase of life. The second phase, it is around from the 20 years to the 50 years. The number is variable. Don't take it is at 20 to 50 only. Okay. It is observed that the middle-aged persons usually goes to the physicians with the complaints of the backache, rheumatoid arthritis, hypertension, diabetes. The unlucky ones go with a more severe disease like psoriasis, tumor, fibroid, complications following hypertension and diabetes. This disease are either accumulative, constructive, or destructive. Those who go into accumulative or constructive type of the disease, they will enter into the psychotic phase of their life. This phase of life wherein a man or a woman is completed his basic studies and is ready to go into the proliferation phase of life. There is a need to proliferate in all aspects of life. This is termed as a progress. So he or she multiplies in terms of posterity by getting married or giving birth to his heirs. He initially worked for need to be fulfilled. The need gradually turned into greed. The more he worked, the more he earned. The more he earned, the more he worked. The greed for accumulations of the money, power, turned him into perfect psychotic achievers. The name, fame, money, prosperity, luxury becomes his basic amenity. The disease which he acquired are of the due to his constitution changing the defense at the cellular level, and that is a shifting of the gear from the soric to the psychotic defense, make the main gain fat. So gain the fat with a rounding of the contours, changing the face, etc. The typical rounded psychotic face with the putting on weight on abdomen, which is a sign of prosperity, is consistent with this phase of a life. A photograph of a face of a man or a woman in their 30 do not show any resemblance to the photograph of the childhood. The journey from Sura to psychosis changes the facial feature considerably, and this is a stage predominated by the psychosis. The third phase, around it starts from the 50 years to the death. It is not the hard and fast rule that you have to keep in mind. The number is variable. Again, this is the stage characterized by the metabolism. After every construction, there has to be a destruction, and this is the rules of life. Man is not an exception to it. The catabolic stage in the life may start in the middle age or in the late 60s or sometime even the 70s. The aging process, which depends upon the genes and the telomeres, which varies with the individual subject. The subject who have inherited long life genes go towards their ultimate end slowly but surely, very late in the life with not many serious disease. On the other hand, those not so lucky start the decline very early in the age. Destructive diseases that the aging persons has to comply with are essentially due to the third or the destructive defense response of the cell to any hostile stimulus. These changes in the defense at the genetic level can occur as a consequences to the accumulative or constructive, that is psychotic disease, or even directly after the psoric disease. If the gene shows a syphilitic trait inherited or acquired. So sometimes from psora to psychosis to syphilis, or sometimes if the gene is encountered as a syphilitic in nature, so from psora directly to the syphilis. Similarly, the psychotic defense can occur very early in the life. A child with the inflammatory disease like a tonsillitis or appendicitis, if not treated properly or if operated, might go into psychosis too early in the age. So you may find that the young boy or a girl suddenly putting on a weight at the very young age of 8, 9 or 10 years and suddenly becoming free of a relapsing fever, relapsing bronchitis or a tonsillitis or recurrent gastric or urinary tract infection. Whether after treatment with the homeopathy or allopathy is not a welcome sign. So this is what early psychosis has been started. This child has been pushed from soric or the physiological defense to the constructive, that is the psychotic defense. Sorry. This child might suffer now from the concealed disease like a hypothyroidism, hypertension, or even a diabetes at very early age. So you may find that some of the girls at the puberty they have put on weight and they are found that they have some thyroid disorders. Also, they may go into hypothyroidism. So this is what early psychosis has been started. The second stage of the life has been hastened by the doctor himself. This amount to the shortening of the lifespan of the child. This child would go into the third stage of the life, that is a syphilitic defense, and start suffering from the destructive or terminal disease very early in the life and die a premature death. So, hope you understand the aging will help us to understand the way which the person is in which miasm. Again, the number is not important. You have to keep your eyes and look at the person so you can understand that this might be a soric in this miasm, this might be in a psychotic in miasm, or this might be in a syphilitic miasm. So, what is the importance of miasm and Herring's law? Very important understanding in the follow-up as we have learned in the theory of separation the importance of the Herring's law, but how it is correlated with the miasm. So this is what very important understanding, that we all know that the disease cure takes place from the above downward, from center to periphery, from inside outward, from more important organ to the less important organ, and in reverse order of the appearance of the disease. So this is what up till now we have understood. But Sir has added another thing into it, that Herring's law said that the disease should disappear in a particular order. Then and only then it can be cured as cure. So this is what from above downward, from center to periphery, from inside out, and from more important organ to the less important organ, and in reverse order of appearance. So Sir added one corollary to it. It is that from more destructive miasm or a destructive process to the less destructive, that is either from syphilis to the sora or from syphilis to the psychosis or psychosis to the sora. So this sir has given an example in this is a man suffering from the leukemia was treated. During the process of treatment, his WBC count down, which was welcome sign as a leukemia, as psychotic taint and psychosis was coming down. But along with WBC count reductions, even hemoglobin came down, which shows the psychosis has gone to the syphilitic state, as destruction sets in the stem cells of the bone marrow, thereby reducing the hemoglobin. The constitutions which was defending itself by the multiplication had suddenly shifted the gear to the destruction. Hence, it was a wrong direction of the cure. The whole case was reviewed and another simillimum was given. After giving the second remedy, the hemoglobin rises, increasing. At the same time, leukocytes also increasing. This was a bad sign from the allopathic sides because the disease was increasing.
पानी भी
It
कुछ
was good
और पी के
for
आ जा और पी के आ जा दिल्ली में आए होते थे अलग कोई बात नहीं
For allopaths, they understand that if the leukocyte has been increased, hemoglobin has been increased, so they understand that the disease is increasing. It was a good from my point of view. This was an indication for me that the destructions of a syphilitic defense, which is the constitutions had adopted, was reverted back to the constructive or the psychotic defense. Later, there was a WBC count reduction and the hemoglobin has been increased. Also, there is a reduction in the lymphocyte count and increasing in the neutrophils count. So neutrophil count, which had never risen in last 3 years, now increased after the right remedy was given. So neutrophil are the sign of the acute inflammations and the lymphocytes are the sign of chronic inflammation. So again, the keep in mind the CBC will guide you that if the person's having a lymphocytic count in the CBC is rising more than the neutrophil, or above the range of the lymphocytic range. So that means the person is defending in a psychotic manner. The chronic inflammatory process is going on. When this is reversing, so the lymphocyte is reducing and the neutrophil is increasing, that means we are reversing from this chronic inflammation to the acute inflammation. That is what we have seen in the CBC report. So neutrophil stand for the acute inflammations and lymphocytes stand for the chronic inflammation. This was absolutely the correct directions of the cure, as reductions in the lymphocyte shows the reduction in the psychosis and increase in neutrophil signifies the increase in psoric taint, that is from psychosis to psora. Hence, the direction of the cure was right. So this is what, by looking into report also you can understand the miasm, and also there is a process that you can understand that the miasm is reversing after looking into reports. During the treatment of the patients with the neurofibromatosis, these are the another example. So neurofibromas disappeared, but the patient developed a renal calculi, which was thrown up by the body itself. This was definitely the right direction of the cure, as the psychosis, which was previously stable, constructive, non-dynamic, and constricted, become a dynamic, mobile, and accumulative, and was finally expelled out of the body by itself. So this is what you have to keep in mind. The psychosis, which was stable, constructive, non-dynamic, and if you found that that psychosis goes into dynamicity or accumulative or a mobile, that means the reversal has been taken place. Again, you have to keep in mind the which layer is patient is in, as according to the theory of separations. Another example, while treating the case of hypertension, if a diastolic pressure goes down and the systolic pressure rises up, it is the right directions of the cure as psychosis to Sora. So this is what you have to keep in mind. For this understanding, we have understanding the hypertension. There are the three type of hypertension. One is the essential hypertension or the white collar hypertension. Second one is the atherosclerotic. Due to atherosclerotic, there is a constant hypertension, and the third one is called as a malignant hypertension. So the keep eye on that the malignant hypertension converted into psychosis and then psychosis to the Sora. So according to that also, if the person is having the blood pressure rising from the 180 or 120, so this is what the both systolic and both diastolic is out of control. It is a malignant hypertension. So whenever you are prescribing that medicines, so systolic pressure is going down. So systolic become 160, diastolic become a 110. Then again systolic become lesser, a 140, diastolic remain 110 or 100, because, or it may rise it. Again the systolic going to 140, diastolic reducing to the 90. Then again diastolic is reducing, again systolic has been increasing. So again systolic become 150, diastolic become a 90. And then the person having a 140 90, then person having a 130 80, and then person having a 120 80. So this is what the SORA is. So reversal from the malignant hypertension to the psychotic to the soric normal blood pressure. So keep in mind that the hypertension has to be changed in this manner. This is the case of the threatened malignancy and the patient complaining of the tiredness, restlessness on walking, suggestive of anemia. The patient was also suffering from the menorrhagia. Sonography shows in the homogeneous ecostructure due to the multiple fibroid, thickened endometrium due to endometrial hyperplasia, query endometrial CA. This suggested that the psychosyphilitic state, this is stable or permanent psychosis. On the 11th March 2003, the patient was given a single dose of ferrum sulf 1N. After 2 months, That is on the 6th May 2003. The patient reported with the increase in the hemoglobin, fibroid gone, and BP increase, and the swelling of the leg. Here, the disease has gone into dynamic psychosis. That means the psychotic state or the psychotic multiply had gone, and the psychosis dynamic, which can change, had come up. So this is something very important. When the tumor goes and psychotic dynamic comes on, at this stage she was advised antihypertensive by her physician. But when she saw her fibroid gone and hemoglobin increased, she herself refused to believe in her physician and decided to continue with the homeopathy. On 12th July 2003, her faith in homeopathy paid back when her BP came to normal. So this is what we have to May to July. Within 2 months, the dynamic psychosis has been reducing. BP came to the normal, her menses normalized. See how stable psychosis came to dynamic psychosis and finally came to the psoric dysentery. So this is what you have to keep eye on each and every thing. This is the reversal of the miasm. So friends, we are concluding here our today's sessions, and tomorrow we will have a rubric of each and every miasm. So uh, I advise all of you to read this chapter from this book, and also advise all of you to read the meaning of the rubric. So that will help you in understanding how this is put into this historic miasm, how this is put into the psychotic miasm. So that will help you to understand the patient as well as the repertory and as well as the applications of this rubric into your patients. Hope you all enjoy this series and the learning. Soon we will finish our this book, and there is one good news for all of you that our team, Dr. Anand, is going to take a lecture on the approach to the urticaria. So we'll share the Zoom link to all of you in a group in the coming days. We are planning for this, so we'll share it in the group so you can enjoy learning with the approach to the urticaria. So we conclude our day today, and I had a questions from one of the doctors. Uh, so dreams of the house burning, dreams of the self-death, dreams of the father death, dreams of the child death, and dreams of the stool, all are syphilitic in miasm. Anything which is in a destructions, anything which is a fire, all are in the syphilitic miasm. Keep your eye and keep everything. So you can just take a compass of miasm to match everything in the nature in either a sora, psychosis, or syphilis. That's all. Our understanding of the treating the case is something like that. We have to divide disease. We have to understand the man, and we have to understand the physics and the psyche of the man in terms of only three process, that is sora, psychosis, and syphilis. Okay, so this is what you have to keep in a mind. Yes, Dr. Gargo Jani, sir, in sorosyphilitic cases, if the symptoms get back from the syphilis to sora, is it good, or for cure it must come through syphilis to psychosis or then the sora? No, in sorosyphilitic again it came back to the sora, so it is a normal. It is not necessary that the psychosis has to come. So in few days back, I had shown you one figure of that round, the sora, then below that is a psychosis, and above that is a syphilis. So some person may grow from the anti-clockwise from sora to psychosis to syphilis, whereas some go from clockwise sora to syphilis. So again, they came back to from syphilis to sora, and same way syphilis to psychosis to sora. So this is what you have to keep in a mind. So dreams of the snake gone and dreams of the water and the temple come. Is this bad or good sign? Dreams of the water and temple. Temple means the god. God means the psychosis. Water is sura. So this is what the dreams of snake gone and temple come. That is a good sign. Good follow. Dreams of the snake is a distractions. If repetitions, then can we say syphilitic? I don't understand what you want to ask. Once in a while, this type of the dream can be considered syphilitic. Dreams of the snake lead to autoimmune disease or some incurable disease. See, there are dreams of the snake at the different ways. Seeing the snake only, snake is going away also, or snake is biting self, or snake is threatening oneself. So these are the perceptions of the person. That is also understanding that the snake is going. So previously they have a dreams of snake biting, and now the snake is going and snake is passing by. So that means the reversal of that autoimmunity has been started. So that is you have to keep in a mind that the dreams of snake is syphilitic in nature. But whenever the snake is gone, so that is again the reversal has been started.
Means, sir, I want to ask that the patient says there is not a repeated dream of snakes and everything. Once in a while, patient say I have seen this type of dream. Should we consider patient going towards syphilitic?
You have to keep eye on the patient's pathology and the physiological process. Sometime it may happen or sometime not, because our body is taking care of everything. Our immune system is taking care of everything. So it is not hard and fast rule that the once in a while a dreams of the snake can produce autoimmunity, but it can.
Or sometimes most of the patient says dreams યાદ નથી રહેતા, સપનાઓ આવે છે પણ યાદ નથી રહેતા. Can we
Psychosis.
consider
Psychosis.
psychosis? Okay.
Psychosis. It is not syphilis. Psychosis.
Okay. Thank you.
Welcome. Dreams of the knowledge from some persons. If the person is your guru, if a person is your what we called as superpower, so that is something called as is it sometime it is called as psychotic also, sometimes it is called as a sura also, and many a time sir has given that if you have a dreams of your guru, dreams of deity, so you must think of one remedy, that is a Crotalus cascavella. This is what sir has given idea about that, and sir has described on that dream to many, and sir got a wonderful result. And we also having a experience of dreams of our gurus or our deities, and the Crotalus cascavella help us. But that is on the physiological plane. Okay. Dr. Pankti, you have to purchase the book. Everything I cannot give you. For knowledge, you have to invest. 16 years old girl, history of the left parotidectomy, 2 years back, now left breast adenoma, has dreams of her head is taken away by her neighbor or anyone. Here the rubric dream has to be taken as a rubric. I don't understand, Dr. PM, what you had to ask. Head is taken away by her neighbor. Actually, the patient is in a psychosis, and this head means what? This is a control. Your control has been gone. So this is the dreams of syphilis. But you cannot enter through this rubric. You have to understand what was the whole demeanor, whole the physiology, whole the mental aspect of the patients. So you have to keep eye on understanding the will, intellect, moral attachment, sensitivity, and emotions of the patient, and then you can enter through the perception. So her head is taken away by that. I don't understand what you want to ask. So sometimes head is taken away by someone else. It is not a dream, but if the person is behaving that my head is not, I am following someone's head. So there is a perception called as head belongs to others. And the remedy is psychotic. So I can suggest you the puja is one of the best remedy. The head belongs to others and the psychotic presentations. This is my assumption. Huh? This is not, I am just looking at your just data and just assuming that. It is not the rules that you just prescribe the puja. You have to go to the will, intellect, moral, and then you prescribe. Convulsion with any pathology which we called as a SOL, stress occupying lesion, is a psychosis. And if there is an infarct or a lacunar infarct, so that is a ulceration at the level of brain parenchyma, that is a syphilitic in nature. Dreams on a past is not so important, but you have to keep eye in the patients that this might having some autoimmune trait, not the autoimmune disease. So they must have some anxiety concerns. They must have the feeling of guilt. So they have some autoimmune trait. So you need to find out some autoimmune trait in the patient. Yeah. While treating squamous cell carcinoma middle aged 36 years, I gave a phenotype prescriptions, acute pain, sharp sleep, improve that medicine is repetition is required. Repetition is required. Dr. Babalu Rao, there is a different approach for treating carcinoma, and it is not a single remedy to be prescribed in carcinoma. There must be a different remedy to be needed, unless and until you are treating that in. See, squamous cell carcinoma is a proliferative destructive disorders. So in that, most of time the phenotypic prescription is the only way. But you are just giving to subside a certain pain. That is not what we call as we are treating the disease. So you have to again in carcinoma repetition is needed, and also sometimes it is what I read from Dr. R.P. Patel's book that the repetitions of the medicine to be prescribed in LM potency, so that will help you in the cancer cases because Dr. R.P. Patel has treated more than 50,000 cases of the cancer and he has exclusively uses LM potency. So this is a different understanding. So you can apply this approach into this. Same dreams once or a trial should we consider important or repeated dreams? Yes, you can, but you have to understand which is in the soric stage, in the psychotic stage, or in the syphilitic stage. Yeah. Sometimes patient says that earlier dreams of the snake, there was earlier it is the history. You have to find out some trait that is autoimmune. In that case, I had answered that same. Her head is cut and taken in a bag. So that is a syphilitic dream. Absolutely, sir. Dr. PM. Her head is cut. That is cut means the syphilis. Okay. So something you have to find out in the syphilis. So you can take a perception that head is separated from the body. It is something what the dreams, but in subconscious pattern, he is feeling that his head is cut off. So that is what head is separated. Dreams of biting snakes and remove the snake from the room. How should we consider? Biting snake is a syphilitic state and remove the snake from the room. That means the snake is going away. That is a reversal. As I said, how should we consider? You have to take a trait of the patient. Don't enter through this rubric only. Huh? There is a rubric that dreams of biting snake. There is only 4 or 5 remedies in that rubric, and one of the remedies, I think, Shankris is there in this rubric. But you can keep in our eye that if you have a dreams of snake, there must be some Ophidia remedy comes into your case also. After religious things, it disappear. Dreams of snake, it is psychosis. But again, you have to keep that person having some autoimmune trait or not. So you have to understand the will, intellect, moral, and then you have to understand the trait of the persons. That person might go into autoimmunity or not. Falling from the height, which miasm? Falling from the height, it is a psychosis. Psychosis, yes. Conversion without pathology is Sora. So thank you all of you. Dr. Kiran, you need to ask. You have raised the hand.
Yes, sir. You told that the head means control.
Yeah.
So, actually, what should be the psychodynamic in cases of migraine? Can you please brief? You're not, it is related to dreams, but may I want to know?
I will share one of the Dr. What we call as Dr. Ruchi Jain has given an idea about approach to migraine. I will share that video lecture in a group, so you will learn from that. It is not just a khali migraine. Migraine is the pathophysiological changes. So the psychodynamic is different depending upon the causes of the migraine. So migraine is related to blood vessels also, and in blood vessels there is we have a relationship. So the head is associated with the authority. So some issue with the authority can lead to the process of head and pain in head. So that is what you need to find out, what authority. So there must be some domination. There must be some what we call as authoritative proposals, or some the person might be having some what we call as a revolutionary type or anarchist type. They may develop a headache. So for that more understanding, I will share that video in the group, so you can learn from that and you can understand from that.
Thank you very much. Otherwise, we feel the migraine cases are more difficult to treat in general.
Yeah, unless see, for that you have to understand the migraine is not a syphilitic disorder. Migraine is a psychosis mostly
Psychotic.
with the
Yes.
dilatation of the blood. So in that case, you need to prescribe a GCS, and sometimes you require a GCS in a higher potency, either a 1M, 10M, or 50M, because it is a physiological. It comes and goes. It comes and goes. Okay. So
Yes.
in that case, you need to prescribe a dynamic remedy in a higher potency, and then sometime you need to give only a GCS. So for understanding of GCS, you need to understand will, intellect, moral. Don't go directly on the psychodynamics. How the lifespan of the patient develop this disease. So you have to keep everything in your case taking, and then you get the idea that migraine is easy to treat. Okay. It is not, it is our lacking or our lack of understanding which makes us to feel that we are not treating the patient in a better way. But it is what not the migraine is difficult to treat.
Agree. Completely agree. It's our lacking. Yes.
Yeah.
Thank you.
Yeah. We have to brush up ourselves. We have to
जन्म
sharpen our.
भीती तो इथे तर कसली मजबूत होती साधं.
Yeah, that is what. Dr. Sheetal has asked something that in religious
या
persons
नाही त्याचं नाही आहे.
God, is it peculiar? What should we take? Again, the god symbolize safety and security in certain people. So why that person goes into security and safety? You have to keep eye on that. If the person having attachment to the god and religious because of some insecurity based in their life, then it is a psychotic in nature. Sir has one of the dreams that Sir has even shown a case, the case of God, two deities meeting in one. So one of the Sai Baba and one of the goddess Ganesha, both are meeting in one place, and this is what something is there, and they become one. So in the case was of something called as cancer, leukemia, case of a leukemia, and this child having this type of dream. So sir took that a dream illuminating, and the remedy prescribed was Crotalus cascavella to that, and that is what the case I remember from the search. So sometimes you have to keep eye that what the disease patient presenting you with the dreams of this type of god. So if it is a psychotic disease, then it is psychotic. If it is a syphilitic disorder, keep your eye to this and you can take into considerations. Yeah, doctor, you know that the Crotalus cascavella was prescribed in that case. I understand. You all know because I think you had done SCPH, so you know the search process and everything. So thank you so much. We have a wonderful sessions on understanding. So thank you all. So we conclude the day today, and from tomorrow we will reading the rubrics and understanding of that rubrics in the particular miasm. Thank you.